Although stellate ganglion block has been very successful in the lives of many people, SGB has been controversial for a number of reasons. Partly because of a small study that was done years ago by Dr. Robert McClay to determine if SGB was helpful in treating post-traumatic stress. Patients did get better in Dr. McClay's study when they received SGB, but those who received placebo also got better. A new, larger, multi-year study was done by the Army and published in 2019. That larger study used 2 SGB injections rather than 1. In this case, more dramatic improvements were seen with SGB compared to patients that only had the placebo. Those who had received SGB in this new study were clearly more likely to recover from post-traumatic stress. This next interview is with Dr. Turabi. He's one of the doctors and principal investigators who is part of this new published Army study, funded by a grant from the National Institutes of Health. This study is really important because of the findings. So tell me, what exactly was the study, who did it, and why it should be trusted?
The procedure was performed by military doctors in Landstuhl, Germany, which I was at, Womack Army Hospital in Fort Bragg, and Tripler Army Hospital in Hawaii. The ones who were performing the procedure were all active duty physicians. We didn't get any extra incentive to do the procedure. I think that that's a big factor because it wasn't funded by a big pharmaceutical company who was out there to make money. It was just a research group. It was done over a 4-year period of time, so it wasn't just done kind of willy-nilly like that. It was done over a 4-year period of time. They had 1 injection and then another injection 2 weeks later. The results were followed up at 8 weeks and they showed significant improvement in their symptoms. It was a multi-center trial and we used a placebo. So the patients didn't know what they were getting. It was a shot in the neck. You either got a shot at the stellate ganglion block or you got a shot just kind of in the muscle tissue. That helped us kind of determine whether it would work or not. Some procedures you do and you have a placebo effect and the patients have a benefit even though you didn't do the actual procedure that were being studied. But in this study, they did have a benefit with the stellate ganglion block and they didn't have a benefit for the placebo. So we know that it does work. It's not just a placebo effect.
You weren't even a fan of SGB. You were very, I'm not interested, I don't believe in it.
Yeah.
But the study and being part of it has completely changed your opinion.
Yeah, so I was extremely skeptical. I'm an anesthesiologist, pain physician. I don't necessarily even treat patients with PTSD. And so when this came across my desk, I was very skeptical. I was a shot for PTSD. I don't think so. But then sort of going over the theory behind it, discussing it with some of my other colleagues, I decided it was worth a try. I think I was very skeptical, very objective about it. I was like, let me see what happens. But again, the results speaks for themselves. But even before the results came out, I knew that this was something that worked because of my patients' responses and their spouses' responses. Patients giving me hugs, spouses giving me hugs, just telling me my life is totally different. My husband's life is totally different. Thank you so much.
In San Diego, there was a study done a few years ago by Dr. McClay and others. And a lot of people in the medical community didn't like SGB because of the results from his study. It was a small study, and a lot of people who were critics used his study as the reason. Let me just tell you what Dr. McClay told me regarding your study. First of all, before your study results came out, he said, I am by no means saying that SGB has been disproven because of his study. He says it just hasn't been proven. He went on to say, the new study, which is yours, was designed to be both bigger and better than our study. And if the results are positive, then their study will overrule our findings. And then after your study was published, I asked him what was his opinion after reading the results of your study and if it makes him more confident in the use of SGB and if it's a viable treatment in his mind now. And he said, yes, definitely. And that he also plans to personally start offering SGB again more widely now that your study is out there.
We did a bigger study. We used a gold standard for measuring PTSD, which is called the CAPS-5 score. Those patients did well. Our results are there. It's clear that they do get better.
Are there any side effects at all? Does anybody have any kind of a negative reaction to it?
I personally have not had side effects, and that's how we want to keep it. Knock wood. 99.9% of complications happen in the first hour. So possible seizures, possible pneumothorax, which is air in the lung. If you go at C6 level, both of them much less likely.
In the right hands, it's a very safe procedure. The risks are extremely low because we use ultrasound or some other guidance to make sure we're in the right place. It's a medical procedure, it's an injection, so there's risks anytime you have any type of procedure.
They could also be swelling in the neck in the first 8 hours. That could be very dangerous, and that's why we observe people here. And then there's always possibility of infection. So that's why we give people antibiotics.
And basically, you're numbing up some of the nerves that give sensation to the face. So you have some numbness on one side of the face, lasts for about 8 hours, some change in your vision on one eye, some nasal stuffiness. Those are some things that we expect to happen after a stellate ganglion block. And they only last for about 6 to 8 hours, they go away.
There are some exotic things that could happen, irritation of certain nerves. People may have hoarse from that, they may have persistent eye droop. Extremely rare.
I've never had any of these complications occur with any of my patients. If done correctly, the ultrasound technology is so advanced that we can see all the important structures in your neck and avoid them. We can see right where the needle's going. And so those things all really help with decreasing the complication rate.
You know, there are critics, there are people who are not believers in SGB that are in this documentary who still, even after your study, don't support SGB. And Dr. Billings being one, and Dr. Vitin, who runs Warfighter Advance, both amazing people, very successful with what they do in helping other veterans, but they won't support SGB at this point, maybe never. How do we know this study, this current study, hasn't been bought and paid for to give the results it's given?
I don't know what the value of buying this study is. There's no big money-making scheme here. There's no big pharma involved. It's done in military facilities by military doctors. We didn't make anything extra off the study. The procedure itself costs $2 for the medication, so Big Pharma is never going to fund a study for this because they're not going to make any money off of it. So I think, in fact, it's the opposite. I think it's done in military facilities. We had no incentive to do the procedure beyond the fact that we wanted to help people.
And I talked to a lot of doctors currently in the military who are using SGB, and they literally told me, I don't get paid anything extra to do this procedure. I only do it because I've seen such a huge dramatic change in the patients I'm serving. They do it because they said it works.
So the risk is very low, the complication rate's very low, but the benefit can be just incredible and amazing. So that's kind of, even though we don't know fully how it works, we still do it. There's a lot of things in medicine that we don't know fully how it works, and we still do it. An example is when you go under anesthesia, the anesthesia gas we use, we don't know fully how it works. That's just a theory. We have theories of how it works, but we don't know. So then that happens every day, all over the country, all over the world.
I had another critic say that SGB is a medical treatment that's trying to solve a non-medical issue.
My argument for that is, how do you know it's a non-medical issue? You know, we don't really know that much about PTSD. I think it is a medical issue. You've got your sympathetic nervous system is overactive, and that's a medical issue. And it's causing your PTSD, anxiety, hypervigilance, sleep issues. So, you know, if it's not medical, then what is it? Just because it's a shot, people get kind of, oh, it's a shot, but you know, it's a targeted shot directly where the problem is.
So I have another critic, and they're saying if you prevent the reaction of fight and flight from happening with an injection, then the owner of the brain is prevented from having that natural reaction that they should have. So is the shot taking away that natural reaction?
So I actually had a lot of special operators come in and say, I need that fight or flight response. I need to be able to kick down a door, look around, and be vigilant or hypervigilant and see what's going on. So this doesn't take it away permanently. This takes it away for 6 hours. Now, the guy that's kicking down the door, he doesn't need that response all the time when he's sitting and watching a movie, relaxing at home. He doesn't need to be hypervigilant, right? He actually needs the opposite. He needs to be able to relax, calm down. That fight or flight response is there only when it's needed. There was a study done where they tested patients after they had the stellate ganglion block, their ability to respond quickly. And they actually improved after the stellate ganglion block. They had a better ability to respond to situations where they needed that flight or fight response. Most of the referrals that I got for this procedure are from psychologists and psychiatrists. And a lot of them have reached a wall with the type of treatments they can provide. And they send the patient to me so that they can get the block and provide them a window to sort of do these other treatment options. And I think that those treatments are more effective during that period of time after they've had the stellate ganglion block.
Now, that's a good point. After the procedure, it opens up a window to where the patient or the person is at a place where they can finally actually get the benefit of other options and other help and other treatments.
What I've realized from treating now about 30 cases with physicians who provide stellate ganglion block is that while it's not a cure, it seems to really accelerate the positive effects of therapy. when we address the biological symptoms of hyperarousal, which includes difficulty concentrating, then they are able to make much better use of the treatment that follows. Not just therapy, but meditation and equine therapy and other solutions and treatments that can be offered for follow-up care will penetrate and integrate much more deeply and will help them come to a new normal. So I see it as really an important treatment to pair with really good follow-up care.
So talk about what you have coming up. You're doing an SGB treatment with some veterans in Chicago, and then immediately you're flying them out to California for a program.
So what I'm going to do is we've gotten funding to send a group of veterans all together on the same day to get the Stellate Ganglion Block injection, and then fly straight into a really high quality aftercare program that's like wraparound support that has equine therapy and meditation and also therapists and licensed professionals, and I'll be there with them all week to support that. So we've got a team that's coming in to get treatment and a team of providers that have different expertise that are coming to surround them and really help them find what I hope will be a new normal.
In conjunction with those other treatments, I think works extremely well. And I've seen it firsthand, the studies there. And so, there's a point where you have to stop being critical and open your mind a little bit and see kind of the results that we're seeing as well.
It's important to remember that SGB is not a cure, that for long-term results, it works best in combination with other treatments. You must use a doctor that has a lot of experience doing SGB, and you must make sure that the doctor uses ultrasound or some other type of guidance so that they know exactly where the needle is going.